Okay. Have your attention, please. Hello, can I have your attention? So we are going to start. Thank you. Thank you. Welcome back to our second session. So this afternoon's session is what can we do sustainable healthcare and circular economy solutions in practice. One of my favorite topic. So my name is Annie. I'm CEO of Go Circular, and it's my pleasure to facilitate this session. Before we get started, we will hear from our co-major sponsor, David Chloe from McDonald's. Welcome, David.
Thank you. Great, another sponsored presentation. Here we go. We're going to be sold to. I know what you're all thinking. No, thank you for inviting me here today. Mike McDonald, we're pleased to sponsor the Climate and Health Alliance. I come from Yagara and Turrbal country up in Queensland, so it's my pleasure to be here today. Like everyone, I'm going to go through these slides fairly quickly because it's really refreshing to finally speak to an audience that has probably developed most of this work, as opposed to speaking to people who we're trying to convince. So why am I here today, and who is Mike McDonald, and why am I here talking to you? So Mike McDonald, we're 150 years old actually. We started in the UK mainly as civil infrastructure engineers, mainly working on large rail systems, airports and whatnot. But we're a close partner of the NHS, and we have decided to bring all that out to Australia. So hopefully get some of the engineering and development learnings to this country. Now, we're actually the first people in our field to be certified carbon neutral, and it is a core value of ours. And it's in everything we do is about sustainability and climate resilience. So size and scale of DPO, oh geez, that didn't turn out well. There's supposed to be a map there and whatnot, but you know this, so I'm going to skip it. You know this too, I'm going to skip that. The net zero building standard. So we've spoken a lot today about operational carbon, and that is where you guys as clinicians, as hospital administrators and executive can have the biggest impact. But I'm going to talk to you from an engineering point of view, and I'm not an engineer, so best of luck. Now, the net zero building standard is something that we focus on from an embodied carbon. So as you know the embodied carbon. We've seen this multiple times today, right? But we know the embodied carbon, and it's around the life cycle of a project, and we need to start looking at the life cycle. But the decisions you make in the planning process of a project where you can have influence will impact the whole of life aspect of carbon. Now, you're all clinicians. Now, I'm a business case specialist. I work with clinicians that come in, and we try to get these business cases to government to say, you should invest $1 billion into our hospital. We need new wards, we need new central energy plants, blah, blah, blah. We've heard it all the time. So what can you do? Now, the biggest thing as a consultant, when we come into these projects is I know you guys are under pressure. You've got your day jobs, and then you're being dragged into another meeting, another governance thing, more PCG reports that you have to view, and it is painful. But that's where you can make the biggest impact. These PCGs, the PSCs that you sit on, they're the ones that make the decision about the direction of the project and what is included. Now, when you sit in front of these executives, I'm ashamed to say, I don't know if it's like this in New South Wales, but in Queensland, sustainability is looked at purely from a design solution rather than a whole of life solution. And we get there, it goes up to the board, goes up to government and cabinet, they go, oh, $3 million on solar panels. Geez, that's not a good look. We'll cut that. And then we'll cut all these other aspects. Water retention, we'll cut that too. That's not a good solution. But what we found in Queensland and potentially down here in other states is that we're not articulating the benefits that we get downstairs well enough. Like if we have a solar panel on the roof, yes, it offsets the electricity, but by how much? What will this do from a practical sense? And it's about better explaining numbers. Now, this is about the strategic business case. So at the gate zero, the very first strategic business case in order to get your funding up, it's about, that's where you can have the biggest impact. And that is about clearly defining your models of care. what impact does that have on your design? Is there an alternative? Because the biggest way to reduce embodied carbon is to build nothing. And then you build less, and then you build clever, and then you build efficiently. Pretty simple, right? Operational carbon, we've seen that. Use less energy. It's the biggest way to get the biggest impacts on your carbon output. But that's all easily said and done. So we at MOTS, we pride ourselves in the way we deliver projects, and you guys know health. You probably know health better than I do. But the fact is that I'm here to probably show you what some of the other sectors are doing. What are they doing in stadiums? Brisbane's about to host an Olympic Games, and the Premier just tweeted probably about 30 minutes ago that it's going to save more carbon than it produces. Now we're doing some of the stadium designs over that, so we'll see how that goes. But what are we doing in stadium? What are we doing in transport? This is what we did on Adelaide Oval. So Adelaide Oval, if you're any cricket or AFL fans here, is a beautiful stadium, and it's got one of the best facilities around. But this is how they track their tools. So what I'm going to show you today is a bit of a range of how can you get your Power BI dashboards? How can you link it to your building management systems to show your carbon? And I'm actually even going to show you something about a big hydropower project where we've used it. Well, we're working with the company that's using a disused gold mine to pump water 300 meters into the air and let it run down to generate energy. Now, that has serious impacts on embodied carbon. But before I get to that, this is our Melbourne office. Have you guys heard the saying, eat your own dog food? Huh? Yeah, it's a Microsoft term. And it's really about using the tools that you developed to help your own business, right? So this is how we manage our Melbourne office. And we manage it accordingly. So this is, I think, in Collins Street, I think. Not sure, quite can't remember the address. But we monitor where our staff sit, anything we can do about elevator usage, about where, lighting, energy resources. So we monitor that. And that's in, I think, 15-minute intervals. But this one I'm here going to show you, this is where we've developed a carbon digital twin to really showcase the energy. 2 minutes to go, thank you very much. Now, Nick mentioned before about some of the aspects about being able to visualize data and being able to visualize the benefits. With this, as you can see, you still have to stand up to physics. Those red sections you see at the end is using augmented reality to try and show you where your carbon intensity is. So our engineers can go in now and say, you know what, we're going to reduce this concrete wall by a meter, and you're going to save $20 million in carbon output in dollars, as well as how many tons in carbon. And we can go through each element of the engineering process to design this. That is a massive project. And I think they've just announced 3 more in Queensland. So look, that's all I'm going to show you today. There are tools available. We have a bespoke tool called the Moada Carbon Portal, where we can understand each element of the building design, and you can calculate the cost and the impact to your carbon baseline. And that drives all these different, so whether it's a Power BI dashboard, augmented reality, there are many different ways to visualize your data and to provide that business case to your executive team. So thanks very much. Really appreciate your time today.
Thank you, Maud, for our co-sponsor, and thank you, David, for the presentation. So this session is focused on what can we do sustainable healthcare and circular economy solutions in practice. So this session basically will showcase innovative circular economy solutions and approaches from healthcare sector. So we heard about this morning and this afternoon, we heard lots about circular economy. So what is circular economy? A circular economy is a system solution that address global challenges like climate change, biodiversity loss, waste, and pollution. It's based on 3 core principles: eliminate waste and pollution, keep products and materials in use as long as possible in their highest value, and regenerate natural systems. So you will hear from our speakers how they have put sustainability and circular economy into practice. So before I invite our first speaker, a few quick reminder before for some housekeeping. We encourage all attendees to submit questions by Slido. you guys already used that this morning. So there will be panel Q&A at the end. If you are joining us online, we encourage you to share your comment while the room chat function. Please do not type Ramsey is handsome anymore, because we already know that. So you can also, we will say the time, because after lunch, sometimes our brain might be slow. I will say how that time we might have like 30 seconds for everyone in the room or people online. If you're in the room, you can turn to people sit on your left or right, share 30 seconds of key takeaway from each presenters. If you're in online, please type that your key takeaway in the chat function as well. See how it goes with time. You can also tweet using the hashtag GreenHealthForum22. Okay, now I would like to introduce our first two presenters, Dr. Stacey McMullen and Sharon Barrack. Stacey is a descendant of the Cooma people of Queensland and has lived and worked in Awabakal land in Newcastle her whole life. She is an Aboriginal clinical psychologist and an Indigenous scholar and lecturer at the School of Psychological Science at the University of Newcastle. Sharon is a proud Warami woman and an Aboriginal engagement manager at Hunter New England Health. In her role, Sharon acts as a key conduit with the local Aboriginal communities and staff to embed cultural perspectives to Hunter New England Health services. Please welcome Stacey and Sharon to the stage.
Okay, so hi everyone. Before I begin, I would like to take a moment to acknowledge the traditional custodians of the land that we're actually meeting on today, the Awabakal people. I would also like to pay respects to their elders past, present and emerging. And as a proud Cooma woman, I would also like to acknowledge my mob, the Cooma people, as their knowledge, sacrifices and suffering has allowed me to share some of this information with you today. So when I talk about caring for country, for us, country is more than a physical place. Country is a living entity. It has a yesterday, it has a today, it has a tomorrow with a consciousness, an action and a will toward life. It holds our stories, it holds our tradition, it holds a part of who we are. Country is home and peace, nourishment for body, mind and spirit and heart's ease. So that means for us, if we're caring for country, it will care for us. And again, it's not just the physical management of the geographical area, it's actually looking after all of the values, places, resources, stories, and cultural obligations that we have that are associated with that area. It also is associated with processes of spiritual renewal for us, connecting with ancestors, food provisions, and maintaining our kin relations and connections, and giving us a sense of well-being. There are many benefits for caring for country, and these extend beyond Indigenous people. If we consider the environmental benefits, excitingly, there is so much research coming out now about the benefits of Indigenous knowledge in caring for country and looking at biodiversity conservation, improved environmental condition of the land and the sea, restoration of wetlands, water resource management, lower rates of weed infestation, healthier fire regimes, adaptive management for wildlife resources and enhanced production of some species. I could go on and on and on about the considerable amount of environmental benefits of caring for country. But we also have the cultural benefits. As country holds a part of who we are and our tradition, our practices, our obligations, if we're caring for country, we're investing in our knowledge. We are preserving cultural learning and translation of the knowledge through the generations. And that includes traditional languages. It includes information about, knowledge about special places and sites and cultural, spiritual meanings. But it also gives us opportunities to have a sense of cohesion and connection with kin and our ancestors and community beyond us as an individual, which is really important for Aboriginal and Torres Strait Islander peoples. So it helps this sense of forming a part of our identity, who we are among this bigger collective and belonging to something that's bigger than us. It's a platform for strengthening that identity, sense of belonging, but also linking us to past, present, and future. If we think about Aboriginal health and well-being, this is an amazing framework that was actually developed by a few very deadly colleagues of mine. They do amazing work, and this is the holistic view of Aboriginal well-being. It incorporates connecting to our land. It incorporates connecting to our culture, spirituality, community, family, our mental and emotional well-being, and our physical well-being. And so as you can see, caring for country encapsulates all the things that we need to stay well. Research has indicated that caring for country has numerous health benefits, including increasing sense of control over life, community, economic, social development, self-reliance and self-determination, which is really important. Provision of basic needs beyond clinical health services, and then a whole range of physical health benefits have been associated with caring for country activities. We also have socio-political benefits, the opportunities for education, training, skill development, reduced substance abuse, greater social cohesion, increased community pride, and improved early childhood development as we involve our children in caring for country activities. There's reductions in antisocial behaviour, community autonomy and Indigenous sovereignty is improved, and fostering equal relationships and partnerships between Indigenous people and formal structures and systems that may not have been previously positive has come out of caring for country activities and embedding them into different designs and different programs. And then we have economic benefits. It's a viable means by which socioeconomic disadvantage faced by Aboriginal and Torres Strait Islander peoples can be addressed. There's cost savings in health. If we're well, we're not going to cost the health system as much. And so there's likely further savings arising in the future with reduced hospital costs, etc. So how can we embed caring for country into the sustainable development focus within health services? We can start with considering, the architecture of hospitals and clinics, as these may affect Indigenous people's decisions about accessing health services, meeting appointment times, and it affects their experience during treatment. There has been some emerging research in this area in Indigenous design and architecture within health spaces, and it points to preferences for outdoor spaces, views of nature. We need to see country, large family rooms, because we are a part of, we're an individual that's part of a bigger community and a bigger kinship network. We need our mob to be able to come and visit us and have some privacy when we're in health facilities, and also privacy in waiting rooms. But it extends beyond the actual design of the facility to how can we actually ensure that within this facility, we can bring in activities, caring for country activities into those health settings. We can have local elders come in and engage in different activities. It might be maintaining a garden and teaching the younger generations, passing on knowledge down to the generation beyond them. So it's really helping that cultural transgression of knowledge, that translation of knowledge through generations, which fills our cup up and helps us stay well. But I'll hand over to Sharon with some of the amazing work she's done.
Thank you. Okay, so before I start, I'm just going to ask you all to close your eyes. If you can all take a deep breath. Think about a place that is special to you. Think about how it feels, how it smells, how it looks, and how it sounds. Think about what makes that place special to you and your family. Think about your family, your friends, your community. So get you to open your eyes. All those things that you were thinking of just then, all those things that you're feeling, that's kinship and that's our Aboriginal culture. That's what embeds us in our culture every single day. So being connected to kinship in Aboriginal culture is essential for healing. So I'm going to talk to you about the next step, so embedding Aboriginal knowledge into new builds. So Aboriginal culture is developing a stronger presence in the New South Wales planning system, undertaking this is a word I'll get stuck with, archaeological investigations and recording Aboriginal heritage is a well-established part of the planning process. But there's one part that we miss, and that's the response to country and culture in the design of places. So it's a new idea. So it's the first step. Through our projects at Hunter New England Health, something that we have started doing is committing to helping support the health and wellbeing of country by valuing, respecting, and being guided by Aboriginal people. So Aboriginal people know that, as Stacey said, if we care for country, it'll care for us. And a part of caring for country is those authentic conversations that happen in the first initial phase. So caring for country, it's not only caring for the land, it's caring for ourselves. Country holds everything, including spaces and places. Spaces and places, even in those urban centres, are full of country and therefore need appropriate cultural care to ensure healthy landscapes. So we talk about our connection to land when we talk about designing with country. So by that we mean spiritually, through our ancestors, through our kinship. So all of those things that you just thought of, that's cultural continuity. We talk about being embedded through designing with country in mind. So as Stacey said, including textures and colours. So like the wood in this room, how amazing is it to be sitting in a textured room rather than a white walled space? Bringing the outdoors in, so having a space to sit and yarn with your family. Designing with country is not possible without engaging and, more importantly, being guided by Aboriginal community and recognised knowledge holders. Every country has them, every location will have those people. Country is a cultural determinant to health as well, so it links with our social and emotional wellbeing, and it holds a significant place to our overall wellbeing and our identity as Aboriginal and Torres Strait Islander people. So what are we doing differently at Hunter New England Health? So we have been using the 8 ways of learning. So this is an amazing way of starting from scratch. So it's a way of working that extends beyond cultural awareness, sensitivity and responsiveness. It's about relating to and responding holistically to people, land, culture, language and spirit. It's a way to develop relationships as well. So being responsive in our practice in the way that you work with Aboriginal people in our communities. So I'm going to break them down for you. So what have we been doing? So our land links, we're talking about authentic conversations. We're talking about site walks with our Aboriginal elders in our community, learning about the tangible cultural heritage. So talking about objects, artefacts, building, places, monuments. Our community links, we're establishing relationships to learn about intangible cultural heritage. So our cultural practices that Stacey talked about, our medicine, our mobs, our traditions, our language. And we have our non-linear as well. So constant communication, story sharing, so cultural immersion, so taking people actually onto country and learning about why we do what we do. And then embedding learnings from consultations into designs using our learning maps. We have our non-verbal, so we see, we think, we act, so applying kinesthetic skills to our thinking and learning. Our symbols and images, so sharing knowledge through art and objects, using Aboriginal art in wayfinding, using our textures in wayfinding as well. Deconstruct and reconstruct, so working from the whole parts, so watching then doing. So at Hunter New England, we have just regenerated 750 seedlings that we're going to replant along our new road. We're going to restore some of our trees that we're felling into furniture. We're sending them to our local Aboriginal land councils as well to make artefacts that our men's groups and women's groups can use them. So teaching generations of knowledge as well. So our continuous journey, so we have our education on country, not only just Hunter New England stuff, our whole project team, so starting from our builders, all the way up to the top to our executives, partnerships with Arts for Health, so learning about how arts focuses in on the healing as well for our psychological health, continuous communication with community, so making sure our community knows what's happening, when it's happening, not after. And we're removing tokenism and consciously adapting to authenticity. So not just putting a picture on a wall and being done with it. So I'm going to leave you with one thought, and this is one of the rooms that we've just recently done in our Neo intensive care unit. So this is our bereavement room, and as you can see, it is very different to what you would normally have. We've applied lots of textures. We've consulted with our palliative care team. We've consulted with our Aboriginal community and our elders, and we consulted with some families that had lost babies as well and that need to use that space. We incorporated our songline, so our land, sky and water as well, rather than having an Aboriginal picture, so it applies to everybody. And we removed anything tokenistic from that room as well. So a culturally respectful and welcoming environment is more than just Aboriginal flags and artworks displayed around the building. So think about all those things we talked about at the start and go from there. Thank you.
Please join me to thank you, Stacey and Sharon again. Thank you. If you have any questions, please put on the slide. We have so much to learn from Aboriginal culture and knowledge. I was going to ask you guys to share what your key takeaway. Maybe we do next one. Our next speaker is Wendy Hurd. Wendy is a mechanical engineer passionate about environmental sustainability, carbon management, education, and climate risk. Wendy worked at Sydney Water and TAFE New South Wales in environmental education. In the past 5 years as a sustainability manager to Southwestern Sydney Local Health District, she has noticed the increased demand for New South Wales Health to do more environmental sustainability. Please join me to welcome Wendy.
All right, I'm going to go through a very practical thing that we've done here at Southwestern Sydney Local Health District to increase our streamlining of our reuse of assets and our donations using a product called Warp It. It's an online licensed website. There's lots of good reasons why you need to basically make better use of the assets you have before throwing them out. Oh. Sorry, I'm normally pretty loud. I don't think you guys need a mic. Is that all right now? Can you hear that? Thank you. There's lots of good reasons why we should promote ongoing reuse of assets and not just tossing everything away. Reduce waste costs, repurposing assets. It's also in line with, it's allowable for, at least for New South Wales Public Health Departments under the New South Wales Procurement Health Policy, right? You've got to tie it in with your delegations manual, tied in with your delegations manual. You just can't give everything away. You need approvals. What would have happened previously, and that's probably what's happening with you, if you've got something that you're getting rid of, but it's good enough to use, but you don't want to throw it away, you probably sent out emails, maybe use the bulletin board. You hopefully, I'd like to say probably, signed some form of donation or transfer form. Again, New South Wales Health. There's a comment in the New South Wales Health procurement policy about donations and having terms and conditions. Hopefully you filed that form somewhere. And you probably didn't track what it was and where it went to, so you could report on your beautiful waste reuse sometime down the track. That's what we did. I was asked to find something better. There's a program called Warp It. We're the 4th company to use it in Australia. The other ones are University of Queensland, James Cook University and Southern Cross University. It's used by about 1/3 of the NHS trusts. It is an eBay style licensed website. Very easy to use. It's only for work use, for work stuff. It is for it is a company specific eBay, basically. There's 3 levels. There's the company, your staff that you approve. I have total admin rights. The partner companies you choose, we've lined up with UTS, but they don't use it. So I can't get anything from them, and it's not much use partnering with University of Queensland. And the charities that you accept, we only have 1 charity at the moment. It's the Rotary Hera Group. And then with COVID, we didn't put any anymore. It is donation only. It is work assets for use at work or for donation. Claimant picks up at their costs, and you can customize the T's and C's. Most of the terms and conditions about Warp It as a carrier, and basically the last page is about, I make reference to our New South Wales Health Procurement Policy. It's real simple. You can get regular or daily or weekly updates or turn it off completely. You have a wish list. So if you want a table, you can say, I want a table, and when a table gets put on, you get notified that a table's been put on. It includes what, where, who, how. Just print out an Excel report. And the best thing, particularly for charities, you can post it now and say, but you can't pick it up till March. So if you're working with a charity group and they're getting containers, that's what they want. There is not much use me ringing up the lovely Rotary man, Keith, and going, well, you want 5 electric beds tomorrow? And we'll go, yeah, cool. But you've got nowhere to put them. Right? So planning, people. Planning is key. So at the time I wrote this has actually been running for 2 years now. We do something like, in that year, we purchased $234,000 worth of chairs, another $2 million worth of assorted furniture. And at the same time, we spent $110,000 in furniture removal and tip fees. Now, if you go to the website, the Warp It website, and look at their League of Legends, the University College of London has saved £1.5 million. That's probably in about 5 or 7 years. Some of the paybacks for these companies was like 2 or 3 days. Right. So how about us? That's what it looks like. Pretty much most of it's customizable. So for us, if you go from the, hang on, I think I have there. Our savings over 2 years is $34,000. Well, it's actually $37,000 yesterday, right? Of equipment that has been reused. That's the purchase price, right? There is no value to this stuff because it's going in the tip. But the purchase price, for example, we just give away internally reused 16 under desk drawers, right? Because the people who moved into their new office took their desk drawers with them, but it turns out they didn't fit under the new desks. And the people who moved into their office had bought new desk drawers, and someone had already bought that. So yeah, but they've been given away, all 16 of them given away, $200 a pop. That's $3,000. So $37,000 saved in 2 years. It's cost us $8,000, right? That's because we've got 12,000 staff. It is a staff-based payment system. You've got less staff, you pay less money. Right, that's about $800 a month, well worth the effort. But particularly, it's allowed us to streamline what goes to charity. All right, we've given $217,000 worth of equipment to charity, basically the Rotary Hera Group. They take our electric beds that we don't need. They take old humidity cribs, slings, all sorts of stuff. It's very simple. You fill it in. There's an equipment, there's a category list, so you can actually, it automatically tries to fit it in a particular category. And again, the post now, pick up later is the best thing. Not everything can be warpited, right? Anything with a brain, like a laptops, have to go back to IT to get wiped, and they go off to a separate vendor who also then scrubs them and sells them. Biomedical goes back to biomedical, so they can do what they do it, and then they put it up on Warpit. Anything with asset number. It worked better when we had an old storeroom at Liverpool, but that's now become PPE. Lack of planning is still a big issue. I got a phone call a month ago from someone who had a room full of furniture that they thought they were giving away, but then suddenly they weren't. And they wanted me to do something about it at 4 o'clock on a Friday, but it had to be cleared on Monday morning. Nothing I can do. Not as many people are using it as we could. We've got about 80 people, with a few more coming on. And distance is a problem because it's not much use sending some stuff from Bankstown to Barrow because it's 100 k's. They have sent stuff, but it's bigger, bulkier stuff like 48 bedside table drawers. I need you all to come on board because other LHD hospitals are closer than some of my own. Does it work? Yep, it works really well. So if it works, if it doesn't work, put it in the bin. But we have been also looking at trying to establish some relationships, like with the men's shed. We have a lot of old wooden furniture, which the men's shed could pull apart, repaint, and sell it. That's fine. Died during COVID. I've got a couple other groups. It works really well. For those of you who are in public hospitals who are on the whole of government waste contract, this has been spoken about and presented at the whole of government health forum. And in August, I presented this at the whole of government waste contract treasury forum. That's it. It works really well.
Transition into a more circular economy, not just address some environmental issues and also address some social issues. Great example, Wendy. Thank you. Our next presentation is a joint presentation from Susan Fallow and Danny Marone. Susan is the hospital service manager at St. Andrew's War Memorial Hospital. Winner of the Uniting Care. Susan is a recycling champion at the Uniting Care and collaborates closely with Uniting Care's service providers to promote and develop new recycling opportunities for the hospital. Susan's passion has made the waste management program a success. Danny is an entrepreneur in the circular economy field. She is the founder of CircleMed. Through Danny's stewardship, CircleMed manages a world-leading recycling program, which returns large volumes of medical-grade plastics back into industry. Please welcome Susan and Danny.
Sorry. We do have a video that we're trying to get up that goes before the slide. Yeah.
St Andrews and CircMed, changing how we manage our waste one bin at a time. For St Andrews, this really is just the tip of the iceberg for our organisation. At St Andrews, we really are all mad and we make a difference every day. Our staff, our teams, we all do what matters and we all know that what we do makes a difference. Partnering with CircMed as our vendor of choice for managing our soft plastic solution has given us the capability to roll this project out across our whole organisation. So we're looking from Brisbane through to Hervey Bay. CircMed can actually offer a collection service. Environmental sustainability is at the very core of everything we do. It's embedded into our culture. So we all have a responsibility to walk the talk, step up. There's an expectation not only from our patients and clients, but also our staff and doctors. We're starting to see a generational shift in the workforce, a changing of the baton. And as the younger people come into the workforce, there's an expectation around sustainability and our commitment. So they've all grown up with environmental sustainability. And through our social media platforms, we can continue to promote this in our workforce. So number one rule, keep it simple, Susan. That's what I told myself. You got to get yourself a team of bin chickens. So Danny and I, we're bin chickens. We got a whole team of bin chickens, from procedural through to clinical to support services. It has been a hospital-wide team effort to really promote this project. When we talk about soft plastics, when you start to look at the scope and the scale of this project, you're looking at your disposable curtains, your plastic packaging, your pallet wrap, the preformed plastics, the KingGuard, CCT and theatres. Obviously, your procedural areas are your biggest generators of these soft plastics, as you saw in the video. But like I say, it's not till you actually start on this that you realise the exact scale. And we did all of this with no additional labour costs. So increased staff engagement, obviously increased diversion rates. So as you start to spread down the project, then obviously the amount of waste you generate increases. Our staff, our doctors have embraced being a part of this project. And, you know, the partnership with CircMed along with our care and commitment is what made this program a success.
Okay. So I don't know if you noticed, but this is like 5 minutes there, so I don't have my phone. Sorry to people on the phone. So we came prepared, and we are bin chickens. So if you partner with CircMed, you get one of the fares. Just the special people the hospital do. But as Susan already said, it's very much a collaborative process. So CircMed was developed and founded on a passion of mine, actually. I used to be a device rep, so I used to sell you all this stuff that was single use, and I was very aware of the need and the emotional attachment to sorting this out. So that's how this was founded. So thank you to Susan. She was a real trailblazer. She let me test the theory to where we are today. So we are a science-based approach, really kind of talks to what everyone was talking to today. We really use science and data. We've partnered with 3 different tertiary universities to do lots of different studies in the background. Without the data, and I think obviously you said that before, we can't then pitch this to my board and your boards. So that's critical. We do aim to achieve closed loop solutions for healthcare and explore solutions for plastics back into the remade journey. So we're not really interested in just making gumboots. We want to be able to upcycle this. We're looking at making food grade products and closing the loop with healthcare and getting to a medical grade product. So one of the first ones that we will go to market with is these. So all the soft plastic that we've taken from hospitals will remake these by the end of the year. We're hoping so. And then we'll keep continuing that journey. What can we do with the stuff that we get? We're also very committed to going to anywhere there is a health facility. So it doesn't matter of the location. We're currently operational in Cairns. So we chose the most logistically challenged area first, just because I love a challenge. But there's no point doing this unless we do all healthcare. So we were able to do that and really learned through our trials. So we trialled with Susan through 2021 with all the COVID disruptions and all sorts of things that happened, but really allowed us to learn the process. And a lot of that was spoken about today. If you can't achieve this without dipping your toe in the water, giving it a go, and be prepared to fail, or not fail. We don't like to say that word anymore, but be prepared to learn from your mistakes. So where to next? We'll continue to go regional. We're now launching into community care sectors with United Care Queensland. We're going through aged care. We've got an avenue into pharmacy and with pharmaceutical companies as well. And we're looking to the pathology and collection centres. So the scope is endless. Anywhere there is plastic, we can come and get it for you. So what we do, we're not just a waste company and we're not just a recycler. We're more all-encompassing solution. So we collect, we sort and process, and we remanufacture all in one house. So we're not just an avenue or a vehicle for it to go to someone else. It all comes within our facility and we process all that material. We also know that transparency is critical. So we give that data back to the hospitals we work with on a monthly basis. So we will tell you we collected X amount of, I don't know, LMAs like this, and they went to X product. So we'll give you that data that you can then share with your teams. That will give you that. So I've just got time's up, I'm so sorry. So that is CircMed. This is our journey and I'm more than happy to talk to you about it later. Thank you.
Thank you, Susan and Daniel. Before we are going to more delicious presentations, I would encourage all of you here and people online, if you're online, please type one key takeaway so far from all the speakers. If you're in the room, 10 to people sitting on your right, tell them, or if you don't have someone to the right, tell them connect. 40 seconds, what's the key takeaway so far from our speakers? 40 seconds, off you go. I thought it sounded very quiet. Actually, I can tell you guys have so much to share. Excellent. So let's welcome our next speaker. Our next speaker is Yvonne Patrick. Yvonne has clinical and international nursing experience across England, Israel, the US, and Australia. Yvonne has held many leadership positions at Australian hospitals, including now as general manager at Commonwealth Hospital and the peer sector services for the past 3 years. Please join me, welcome Yvonne.
Hello, I would like to start by acknowledging the traditional custodians of the land we're meeting on today, the Awabakal people, and pay my respects to elders past, present, and emerging. My presentation today is Tamworth Rural Referral Hospital Renal Unit Reverse Osmosis Reject Water Reuse Project. Bit of a mouthful. Should have thought of something a bit more jazzy, but there you go. So where is Tamworth? Tamworth is situated on the Peel River. Tamworth is a city in the northwest region of New South Wales, nationally known as the country music capital of Australia, with the famous golden guitar. It was also first known in Australia, it's the first town in Australia with electric street lights in 1888. Probably a little known fact. Population of 64,000, and it is the second largest inland city in New South Wales. The background, 3 years the 3 years of drought from January 2017 to December 2019 were the driest on record in New South Wales. The most extreme rainfall deficiencies occurred in the northern half of New South Wales. I came to Tamworth as the general manager in February 2019. The drought had already been going for 2 years at that stage. It was devastating. The effects of the drought were everywhere: emaciated animals picking at dry dirt, decimated flocks and herds. Farmers often ended up culling animals because they couldn't sell them. There was increased mental health concerns, suicides, dying and desperate wildlife. It was awful. During this time, there was a regular sight of hay bales on trucks for animal feed from different parts of the country, often donated, including, you might remember the Buy a Bale initiative. That was during that time, for example, and that was much appreciated. In 2019, level 5 water restrictions were also brought into effect in the Tamworth, Katingal and Moonbee areas by Tamworth Regional Council to minimise unsustainable potable water consumption. So with the local water supply at Chaffey Dam hitting 12.5% and dropping, a potential source of internal reuse water was identified by the renal unit team. Dr. Manny Panat, who's a renal consultant, raised the question with me whether this could be done. In July 2019, there was also a recommendation from the council to explore regarding potential reuse of the Oro reject water. So what is reverse osmosis? The process of hemodialysis requires large volumes of water in compliance with recommended standards. Potable or mains water does not achieve the required standard. So treatment of the water is needed. This treatment typically involves pre-filtration, softening, filtration through activated carbon, and reverse osmosis. These methods form the most effective treatment process to achieve water of suitable quality for dialysis. The Oro plant that serves the renal dialysis unit at Tamworth Hospital currently produces and supplies approximately 50k litres of Oro permeate water per week to the dialysis unit. The nature of reverse osmosis is that it also generates a waste stream of water, Oro reject water, as a byproduct of this process, of which there's also approximately 50k litres per week, which went directly into the drain and into the waste, into the source. So as the feed water that goes into the Oro plant is pre-treated and filtered to a high level prior to the Oro process, the waste Oro water, reject water produced as a byproduct, is high quality water with salt concentrations that are typically 2 to 3 times higher than their original concentration in the potable feed water, and as such suitable for reuse. It is critical to note that this project only considered reuse of the Oro reject water. It did not recommend reusing dialysate effluent from patients. So a collaborative meeting between the internal departments at the hospital, a number of different possibilities were looked at for possible reuse of the Oro reject water, including cooling tower makeup water, hydrotherapy pool makeup water, flushing of toilets, grounds watering. An assessment was undertaken of the various options utilizing the methodology used in the handbook for reusing or recycling reverse osmosis reject water from hemodialysis and healthcare facilities. Consultation from the current water treatment contractor, facilities management unit, work health and safety, and population health were also undertaken, along with extensive initial analysis of the water to identify any key parameters that may detriment its possible reuse. The cooling tower water was initially considered. However, due to concerns of the possibility of increased risk of scale buildup, it was not recommended at the initial stage. The hydrotherapy pool, this was also a possible option. However, given the proximity of the pool to the source of the water there would need to be significant work undertaken to get the water reticulated to the pool. So the reject water from the Oro unit underwent extensive testing against the guidelines and was deemed safe for reuse in our situation, toilet flush and garden use. In reference to the grounds watering, just to note, this is a short-term option as there may be concerns about salinity build up in the soil if this option is used long-term. So how does the system work? It was initially thought that the toilet flush option may be cost prohibitive, given the changes that would be required to the plumbing reticulation system. Further investigations with the local maintenance team revealed that our Broodland building had a separate reticulation system already in place, and that feeds the toilets in the building separate to the showers and the basins. The Oro water would be ideally suited to this option, provided that it is rechlorinated to provide disinfection of the water to eliminate the potential biological growth. And given the existing plumbing reticulation is largely in place, this option was the best use for the reuse of the water. In consultation with FMU, the water treatment contractor, and Tamworth Maintenance, a system was designed as per the diagram, using the approach recommended in line with Australian water recycling guidelines. The estimated cost of the project was $15,000, which was funded through our district, FMU, and I think, relatively speaking, is not an excessively large amount of money. So since October 2019, the cumulative Oro reject water reused at Tamworth Hospital is greater than 9 million litres. Thank you. Okay, so Tamworth 2022. As you can see at this time, we are no longer in drought. The fields are green, abundance of well-fed animals, bustling cattle market reaching record prices, and Country Music Festival, despite a COVID glitch, has returned. The Chaffey Dam this morning was 100.5%. But we know that another drought in the future, as bad or worse than 2017 to 19, is a real possibility. And that's why we're here today, to be doing everything that we can in health to play our part to drive change in conservation, in this instance, and particularly in the rural setting, water, and to support our communities. I would like to acknowledge the dedicated members of the team as listed. I would also like to highlight that I missed somebody, Stuart Simons, our technical services manager to that list. I was too embarrassed to send Stacey another version of this presentation. So my part was coordination, but it was the innovative staff members that used their expert knowledge and worked at a solution to make it happen. Thank you.
Another great presentation. Please join me to thank you, Yvonne, for sharing the learnings from Tamworth Hospital. Thank you. We are going to have another joint presentation. So we have 3 speakers for this one. First one is Jamie Lin, has spent 15 years working on key strategic activities for New South Wales, New South Health, and is now the Associate Director for Partnership and Project at HealthShare New South Wales. Jamie has taken the reins of the newly formed partnerships and project directorate and will be overseeing the organization's largest and the most complex project, including in sustainability. Our second speaker is Dawn O'Neill. Dawn has over 20 years experience in the mental health sector as the CEO of Lifeline, Beyond Blue, and other leadership roles for mental health and suicide prevention. Dawn is now dedicating for her energy to providing commercially effective alternatives to the damage forever chemicals are having on human health and our planet. Dawn is now CEO of eWater Systems. Our third speaker is Melanie Frost. Melanie is the Associate Director of Food Service Reform at HealthShare New South Wales, focused on the delivery of sustainable food services across New South Wales Health. Melanie is the registered nurse with extensive experience in strategic, clinical, and operational leaderships in healthcare. Please join me, welcome Jamie, Dawn, and Mel.
Thank you so much. Hopefully you can hear me in the room. Just going to start off just with a little bit introduction about the organization, and then I'm really going to hand over to Dawn and Mel for the real crux of the presentation today. So HealthShare New South Wales, if you don't know, is Australia's largest shared service organisation. We play an increasing role in caring directly for public hospital patients, providing them with clinically appropriate transport, nutritious hospital meals, a clean and comfortable hospital experience. And we support all New South Wales health doctors, nurses, allied health, and administrative teams by ensuring that they have the supplies and equipment they need to do their jobs. One of the things that we think about quite a lot is that our size and scale positions us well to drive improvements in the system, whether that be through our statewide procurement, to supply chain arrangements, payroll and human resources support, to hospital linen cleaning, assistive technology and related services, non-emergency patient transport services, and food services. We make sure we reduce wastage and create a positive experience for all New South Wales health staff, in addition to improving the patient experience within our hospitals, in communities, and at home. So when we thought about this, and we talk about sustainability a lot in our organization, we actually believe that our journey started probably more than 10 years ago. And when we look back over the last decade or so, we've actually saved 205 million litres of water per year, reduced our energy down to 207 kilowatts per tonne, and reduced carbon emissions by over 22,000 tonnes. And that's across our 7 laundry facilities. We've streamlined our food services supply chain model to reduce food deliveries and transport emissions. We've had a number of collaborative opportunities, specifically with Arthritis Australia and Nestle, to develop a sustainable packaging procurement tool that has contributed to better patient and environmental outcomes, and actually had a 70% reduction in unopened food packaging. We've upgraded to LED lighting across our patient transport hubs. We've introduced a huge number of food service reform programs that reduce and divert waste from landfill. And we've reduced the number of new medical equipment purchases by up to 80%. And that's by going through our Enable New South Wales refurbishment program. At HealthShare, we actually feel pretty proud that we did this all whilst maintaining BAU services through numerous climate crises, including bushfires, flooding, and drought, as well as uninterrupted operations throughout the COVID-19 pandemic, as we had a huge number of our staff isolated and furloughed, like everybody here. We're obviously still picking up the pieces, but really trying to observe the silver linings where we find them. We know we're already making a difference, but as we look to the future, we also know that there is huge opportunity to do more. We know HealthShare have formalized our sustainability commitments through a dedicated sustainability plan. And really, that's to outline exactly what we want to achieve by 2024. And supported by this plan, we're doing a huge number of activities also. We're enhancing our value-based care by balancing our product or service quality with clinical choice, which is tough with some of the personalities involved across the system, but we're doing that to really achieve the best possible outcomes for patients. We're working extremely hard to reduce our carbon footprint year on year to achieve net zero in line with the New South Government net zero plan. We're collaborating with our partners to improve waste management programs, reduce and divert waste from landfill, innovating with the industry to explore ways we can recycle PPE and remove microplastics from wastewater. We are sourcing sustainable and ethical product alternatives and building operational resilience and reducing our impact in response to the effects of climate change. Above all, we consider our sustainability journey to be finding the opportunities for change. We're doing our best to listen to partners, people, and patients, and to learn and share ideas, and to really make sustainability part of our DNA. Now, we're going to deep dive into 2 amazing initiatives, eWater and Project Chef, which Dawn and Mel will explain in much more detail. But I'd just like to first touch on some of the successes from our eWater pilot. We've piloted eWater in 2 hospital kitchens in collaboration with Barrel and District Hospital and New Maitland Hospital. The eWater cleaning and sanitation products are being used for cleaning of kitchen equipment, surfaces, and fixtures. eWater pilots have demonstrated positive outcomes for HealthShare, including removing 4 different harsh chemicals from cleaning and sanitizing practices. We've got the ability to test, measure efficacy of e-water solution prior to use by test strips, and have a new process where chemical dispensing was not previously tested. A notable improvement with removing stains from cups, meal trays, bench surfaces, and floor surfaces, all looking much cleaner, addressing chemical and residue buildup. Safe for use with no chemical fumes or irritations. And we have a constant supply of e-water solution with no distribution or ordering issues associated with chemicals and reducing the reliance on single-use plastics. As you'll find out, the e-water solution is Australian owned and operated, and the e-water system is easy to use with staff adapting to the change and embracing new safe ways to clean and sanitize. The work is underway to roll out the process of cleaning and sanitizing fruit and vegetables within our sites. The pilot we have here is actually completed in early August of this year, and we're currently undertaking a review to see what the future looks like in this space. So imagine you're asking, what is e-water? Well, I'm now going to pass over to Dawn to explain and answer this question and explain how this amazing technology works. Thank you, Dawn.
Thank you, Jamie. And I'm going to stand over here a little bit so I can see you all. So you've just heard that e-water is a paradigm shift away from the traditional use of chemicals that we ship in that come from a factory. Oh, okay. So then, fair enough. That's all right. I'll stand here. Behave myself. Yeah, so e-water is a disruptor, if you like. So we've changed the paradigm, the thinking around rethinking the way we use chemicals in the workplace to clean and to sanitize. So instead of shipping in packaged chemicals that are generally synthetic with unknown ingredients that have colours and fragrances and various synthetic chemicals often which are harmful for both people and the environment, what we do is we install a piece of equipment, which you can see there above a sink, where you can produce your own solutions with the only inputs being plain salt and tap water and some electricity to work the equipment. So that's salt and water in a saline solution. I'm going to explain how this works. You mix the salt and water together in a brine tank that gets sucked up into the piece of equipment, the electrolysis equipment, and it creates two new solutions, two new chemical solutions, one of which is hypochlorous acid, which for those of you with medical backgrounds in the room know that it's naturally found in our bodies. Our white cells produce it for infection control, and it's the most powerful disinfectant in the chlorine family, but it also very, very safe, completely safe for humans, obviously, because it's in our bodies, and the environment. The other solution is sodium hydroxide, very low parts per million, so a very effective soap or cleaner. So those two solutions, so it's about a circular economy solution, if you like. We're keeping the molecules at play, so it's water and salt, get used for cleaning in those kitchen environments and then get combined again to go down the waterways purely as plain water again. So it's a completely circular solution. Highly effective. We're now in about 500 sites across Australia, 500 or 600 sites, many aged care facilities, about 20 hospitals. The International Convention Centre in Sydney is probably our biggest user, and they use millions of litres a year. So collectively, amongst all of our clients, we've saved about nearly 400 million litres of harmful chemicals from going into our waterways and people being exposed to it, diverted about 80 million plastic containers because most traditional packaged chemicals come in single-use plastics, so reduced that waste and saved our clients and our customers money because the payback period on these solutions, so you can create 4 solutions from the equipment, the payback period is generally about 2 to 3 years for most sites, but the equipment will last many, many years longer than that. So per litre, the cost to produce electrolyzed water for you cleaning and sanitizing, which of course during COVID, we've become much more aware of the importance of both cleaning and sanitising. We were told over and over, you must clean the surface before you sanitise. The cost per litre is less than 1/10 of a cent to produce once the capital costs are there. So the cost savings for hospitals and facilities are significant, as well as the reduction in waste. And as Jamie said, the teams, the staff love it because they're not exposed to chemicals, they're not breathing in chemical fumes, they're not getting the dermatitis on their hands, and it's easier to use. So the applications, obviously in kitchens is the primary location that we've installed e-water systems, but we're increasingly installing for environmental cleaning, so general cleaning, general purpose cleaning. We just installed our biggest ever installation this year at the Hyatt Hotel, which was on 26 floors. So it is possible to plumb the electrolyzed water right throughout buildings to come out at hand wash stations on every floor or every sink or every cleaner's sink or kitchen. So many aged care facilities, there's many sinks and many kitchens. And of course in hospitals, that's the same. So apart from the trial that we've been doing with New South Wales Health, which has been fantastic through the CHEF program, we're also in Royal Children's Hospital, Walper Hospital, Bendigo Hospital, and many, many others. So the solutions are HACCP certified, so that's safe directly on food. So you can use the electrolyzed water to wash and sanitize your food, gets rid of listeria, salmonella, all of your foodborne bacteria that are carried on food. That's very important for kitchens to ensure that those are cleaned off the food and it doesn't taint the taste of food, which is why some of Australia's top chefs love electrolyzed water, like Neil Perry, who's a big fan of e-water and says that he wouldn't have a kitchen without it. And the cleaning applications that I've just talked about can also go into your floor scrubbers for windows, glassware, stainless steel, leathers, vinyls, very, very safe, very gentle to clean with for all your surfaces. And of course, you can refill the spray bottles and take them around a whole facility. So the advantages, the obvious ones, better for the environment. So it's salt water and electricity that creates this. So it's very, very simple. And I can see many of you with quizzical looks saying, how can that possibly work? There are hundreds and hundreds of peer-reviewed papers showing the efficacy of electrolyzed water. It's a technology that's been around for over 50 years, mostly been used in industrial settings, and it's just been commercialised in the past 20 years, a bit like PV cells. We thought, how can we possibly run a household just from the sun? The evidence is there. And of course, the New South Wales trial has proven that. So it's safer, healthier, better for people, better for the planet. And I'm available if you want to find out more afterwards. I'm going to hand over to Melanie.
Thanks, Dawn. I'm going to share some of the work that we're doing at HealthShare New South Wales to try and reduce food waste and deliver sustainable food services for New South Wales Health. Global research shows that about 30% of food that's served to patients ends up in the bin. In a hospital setting, of course, the challenge that we have when that happens is that it's a missed opportunity for nutrition for patients. In New South Wales Health, the scale of our challenge is significant. We operate 158 kitchens across New South Wales. We serve 21 million meals annually. And for us, approximately 25% of the food that we serve goes uneaten. Of course, that's food that's produced, purchased, transported, prepared, delivered to patients and not consumed by patients. There's a direct cost of over $1 million to dispose of that food waste, and it generates 4,000 tonnes of food waste annually. That's the weight of approximately 525 buses and enough to fill the Sydney cricket ground once a week. It generates approximately 245,000 tonnes of carbon emissions annually. And I guess importantly for HealthShare New South Wales, we're not delivering the outcomes and experiences that we want to for patients, and we're not delivering value for our healthcare system. The drivers of food waste are really well understood. Compliance-driven food service delivery models require us to deliver food to patients regardless of whether they're hungry. The ordering systems that we have contribute to missing opportunities for patients to be able to select meals. We deliver food to patients on a schedule that suits the system rather than suits patients. There's limited opportunity in many places for our patients to customise meals in terms of portion size and meal components, particularly where we're using prepackaged meals. And the methods of plating and heating have a detrimental impact on appearance, taste, texture, and smell of the food that we serve. So in 2019, HealthShare New South Wales took an opportunity to undertake a current state review of our food service delivery and held a lot of focus groups to hear from our customers and consumers what they wanted in the food service delivery models of the future. From that work, we developed 6 core design principles, including service excellence, flexible meal access, attractive food, patient choice, patient centricity, and sustainability. We partnered with Southwest Sydney Local Health District to pilot the application of these design principles in a live environment and see what results we would see. So what we did to bring those principles to life was introduce digitally enabled meal ordering using BYO, bring your own devices. We allowed patients and carers to order for themselves rather than have people come and take their meal orders. They were able to order at a time that they felt hungry, that reflected the times that they would more usually eat at home. Of course, we retained bedside ordering for those patients that still required it. There was lots of opportunity for patients to customise the menu to comply with their therapeutic and dietary preferences. The food was heated and plated at the time of order. It was delivered to patients within 60 minutes, and we had a strong focus on improved presentation of that food. There was also an opportunity for our patients to choose the portion size of the food that they were going to be served. So what did we see as a result of the pilot? Really pleasingly, we saw an improved patient meal experience, which was our North Star measure of success. We also saw improved nutritional intake for patients on a background of reduced meals served to patients. This was particularly important in our most nutritionally vulnerable patients where we saw significant improvement. From an environmental perspective, at Bowral and District Hospital, we served 94,000 meals a year. 40% of the food that we served was wasted pre-pilot, and that resulted in 12 tonnes of food waste annually, which went to landfill, creating, of course, thousands of tonnes of carbon emissions. During the pilot, we achieved a 52% reduction in food waste, a combination of reduced tray waste, that's food served to patients, and kitchen waste, so food that's wasted during storage and preparation. We were able to introduce for the first time organic waste separation, and as a result, we're able to achieve zero food waste to landfill. So what's next for us? Of course, as always in a pilot, lots of lessons learned along the way. I guess most importantly, we learned that there's not a one-size-fits-all approach to delivering food services, but there's certainly some foundational pieces that we plan to take forward. We presented the outcomes of our pilot to the Senior Executive Forum for New South Wales Health in August this year and received their support to continue to apply these design principles as we design food services for the future. So we'll focus on applying those principles in a really agile way that delivers the best outcomes for patients in a financially and is financially and environmentally sustainable for districts. We're currently working with the Sydney Children's Hospital Network to redesign food service delivery for paediatric patients, and we've written to each of the chief executives across New South Wales Health, seeking their interest in participating as a flagship site. And we're commencing our meetings with those interested districts between now and Christmas. Thanks for the opportunity to share our work today. There's some contact details there if you'd like to hear more from any of our 3 presenters. Thank you.
Thank you, Jamie, Duong, and Mel. Zero food waste to landfill. I want to dance a bit. Well done. We have another speaker, and then we have a Q&A section. If you guys have any questions, please put in Slido. What's happening there? Our last speaker, Dr. Alex Buller. Hi, Alex. Alex joined us online from New Zealand. Alex is an ophthalmologist and a glaucoma subspecialist. He consults at the Eye Surgery Hastings, which in 2022 became New Zealand's first solar-powered operating theatre. Over to you, Alex.
Hello, I hope you can all hear me from New Zealand here. First of all, big shout out to Dawn from eWater and the HealthShare team. We're using hypochlorous acid in our facility over here in New Zealand. We clean our operating theatre and our clinic with it, have been for a couple of years, and it's fantastic. Talking today about this. Imagine yourself in an operating theatre. What's going on? There's multiple stakeholders, there's complex supply chains, and there's very complex working patterns. If we're going to introduce a sustainability focus here, you've got to parachute it right into the middle of that diagram where all of these three things meet. That means you've got to hit the ground running, because these things can't slow down and wait for you to keep up. You've got to be effective right from the word go. Cataract surgery is the most commonly performed operation in New Zealand, 30,000 operations a year. A recent measurement found 152 kilograms of carbon emissions per case and 1.3 kilograms of landfill per case. And that's the equivalent of an hour's flight on an economy class aircraft. The stakeholders involved are multiple. This list isn't exhaustive. The green band at the top is what the primary focuses of each stakeholder is, and the lilac band below is what that really means. So for patients, their main focus is quality. What they've got on the line is how well they can see for every waking minute for the rest of their lives. They're not really want to compromise on that. Surgeons equally are aligned with the patients. The surgical outcomes are their main priority. Having patients who can see well and are happy is far better than the alternative. For theatre staff, they need ease of use. They do thousands of tasks. They've got a whole team. They're coordinated like a ballet during an operating theatre. They've got plenty of things to do, plenty of single tasks to do, and they've all got to be done in the right sequence. So they've got to coordinate with each other. You can't introduce a more complicated system for them. Oh, suppliers as well, they need clarity. We've got to we can only ask them for things that exist, and they can only ask them for things that they can get to us. And also the facility, a hospital or something smaller like us, they need ease of use. It's no good saying we're going to rejig everything that costs less than $5 in your facility, and all you need to do is triple your members of staff in the admin department. The aims, of course, is to reduce the carbon footprint of healthcare activities, but you won't be able to do that. You won't be able to introduce a procurement system that does that unless it does all of these things. It's got to introduce sustainability, but it's got to maintain clinical quality. It's got to be transparent. You've got different people working in different ways and different times, so they've got to be able to hop in and hop out at any point in the system and know exactly what's going on. It's got to be reproducible. You've got to be able to, it's no good having something that works for one of the things you do. It's got to work for all of the different types of operations that you do. All the stakeholders have got to be served, and you've got to align the stakeholders. You want to introduce something which people say, that worked, it worked nicely, and it was faster, and we got further than what we did with the other things we're going to do. So next time we're talking about it, let's do it that way. What we came up with was asking a series of questions. So you look at every item used for a procedure and then ask the questions. Firstly, is it still needed? Says some historical things there you can let go of straight away. The next thing is it really still needed? If you imagine that a single item can't be got rid of easily, but if you consider a step of an operation using a whole group or a cluster of items together, if you innovate the way you do that step, you might be able to change 2 or 3 of the items as a group. The next thing is can we change a single-use item to a reusable alternative? And if you can't make it reusable, can we use a recyclable or a biodegradable alternative? And if
Thank you, Alex. Sorry, I have to interrupt you. We're running out of time.
Okay,
I would like you to stay with us. So we're going to invite all the speakers on the stage. All right. So should I go ahead, Alex?
Oh, yeah. Carry on with the talk, you mean?
Yes.
Yeah, okay. Yeah, okay. So then the next thing is, can we avoid landfill? Introduce the circular alternative, and you can apply other filters. And for the big one, can we get it local? It's a big one for us. So the next one is that it's a flow chart. So it's all the same questions. We've gone through the red, orange, yellow, green, blue, indigo, and violet stages. So is it an essential item? If it is, then is it really essential? Can we bypass it by changing a process? If you can't, then can we switch it to a permanent alternative? And then we put some stakeholder related caveats on the left there. So if you switch to a permanent alternative, is it feasible to re-sterilize it, reprocess it, and get it back out for the next operation? And then if you switch to a recyclable or a biodegradable one, does the cost of that become feasible, and can you get it? Is the supply chain available for the number of operations that we're doing? And then the same thing for something that's got reduced disposable or less packaging. And then for the circular economy, can we move things in? And that's where all staff come very, very important. And it's a real meritocracy there. And then everything can go through the next filter. Can we get it locally? And you can put other filters on there. This is our journey. The first iteration of our cataract pack, which comes preloaded, had 43 items on it, and then we opened another 23 items to add to that, and the cost was over $100 for the pack itself. The next iteration dropped everything by about 10%, and then currently we're using something that's far reduced from that. The price has come down to less than a half of what it was, and we've managed to remove about 20% of the things that we're using, and we've managed to switch to reusable about 20% of the things that we're using as well. This is a little example of something that we've reduced. The top one is the injector used to put a lens into somebody's eye. And then the bottom one is the current new way of doing it. So we switched to a reusable metal handle. And then that makes that little cartridge that we've got there recyclable. So we've gone from all landfill at the top to no landfill at the bottom. And this is a bag of socks. Patients wear their own clothes into the operating theatre, but not their own shoes. So we put some non-slip socks on them, and then we collect these, put them through our laundry, and then send them to a local charity, which fantastically rehouses household products. All of our socks go to a couple of local schools in a low socioeconomic area where children come to school without socks on. And in these schools, our socks are known as classroom socks. So a sustainability tool provides some focus in a complex situation. It's a neutral common ground for stakeholders to discuss things. The big one is the cost savings, and that's because of alignment of the stakeholders and education in the area. And it introduces efficiencies. If you've got a very complex system, there are some historical inefficiencies in different areas. And then everybody can contribute to this. Thank you very much.
Thank you, Alex, for a presentation. Please stay with us. I would like to welcome all of our speakers on the stage for our Q&A session. Thank you. And is Jamie joining with us? Jamie.
There's your questions.
Oh.
You can choose which ones you think about.
Yes. Yes. Okay, thank you. Thank you for everybody sending their questions to Slido. I might just go through. Someone asked a question, how do we translate caring for country into corporate sustainability strategies to ensure environmental and cultural well-being work together?
Do you want to have a go at it?
I think this is directed to you.
No, yeah, it's fine. It's yeah.
Okay, so there's a little saying in Aboriginal culture, and it's work with us, not for us. So when we think about how environmentally and culturally we can go together to care for country, if we bring it back to the deconstruct, reconstruct from our 8 ways of learning, we can start from scratch. So consulting at the very start, engaging our local Aboriginal land councils, our local Aboriginal organisations as well. So ensuring that we are having those conversations from the get-go, and ensuring that, you know, there's lots of pathways. It is a journey process as well. So starting the journey together. I think I answered that.
Thank you. Question for Secumet, I think. So will you guys collect from primary care practitioners or collect from GP and health providers, pharmacies, and another thing about what's your financial model? Your revenue model for your business.
Okay. Yes, so we do collect from all facilities, and we can do primary care, community care, pharmacies. There's different models for different facilities and centres of how we will do that. We will work with those centres as we talk to them. In terms of our internal revenue stream, we work on multiple functionalities of that. So it is a huge cost to us right now to invest in this. It's a lot of CapEx and a lot of capital raising around that to get to where we need to be. We're on track. And it's a longer term revenue stream. Anything like the world that we're in, especially in sustainability, takes time, but our revenue stream will come more from our feed streams into the remanufactured products. And we're looking to export some of those remade products because then we get bulk supply and we get larger volumes out. So in the interim, we're starting small, but we will scale.
Thank you. Anything to add? This is another question for all the speakers. So given the fantastic examples of sustainable innovation and the circular solutions we heard today, what do the panel think is holding us back from adopting those across the system?
I might take a start on that. Look, I'm not sure about the private areas, but with New South Wales Health, they've finally filled in the gap between between your federal and New South Wales policy and your whatever the LHD aims for. They've got the Ministry of Health Environmental Sustainability Steering Group steered by the Deputy Secretary, and the Net Zero Group, which I think Erin's here to talk about later on. So that executive support and executive drive is going to come because there's only so much we can do at a local level. You can do a lot, but at some point you're pushing uphill, and being told you have to do it works really well. Targets are also very good.
Look, I think that one of the biggest challenges that's holding us back is time. We're so focused doing busyness and the pressure to deliver these business cases to get to government and to make these decisions. But by taking the time out early in the planning process, you can actually get better outcomes. Getting the country outcomes in the design and in the planning phase, unfortunately, it's just so rushed these days, and you're constantly going into meetings that need to be addressed. Like, let's get those outcomes, not meeting for the sake of meeting, and actually driving that through the decision makers. So in the process, when you're in these meetings, just make sure there's those tangible outcomes with how you actually get to the decision about the country, about the design, and making sure in the financial models that come through the outputs, you can actually see where the savings are from your sustainability initiatives, because they never come through. You just see the $500 million for capital, and then it just goes through the government motions. But you need to start, as the front line of all this, you need to start asking those questions of your project teams.
Sorry. I could spend hours on this. So policies and procedures, obviously coming back to systems and values. So talking about, breaking it down, starting from scratch, having those conversations, as you said. So if we're having those authentic consultations at the start, we're actually going to save money in the end project, because we're going to be able to answer those questions. We're going to be having those conversations, getting those outcomes at the design phase rather than the implementation phase.
And speaking as a small Australian business that's bringing a completely new product into, which is a new category, really overcoming people's mindsets around changing behaviour has been massive. Our very first site was Austin Hospital in Victoria, which was 15 years ago. So it's taken a long time to get to actually having a trial with a full health system because people are conservative, obviously, you know, for good reasons about making sure hygiene systems work, but getting systems, whole systems to change is really a big challenge, but I think we're getting there.
Also, I think it's the same in the clinical areas when you go and work with them. They're very focused on what their outcome is. So getting them to actually make a small change in the step in that process, once you get that on board, you get that momentum.
And I think you've proven that having internal champions makes all the difference.
You need your bean chicken.
Any further comments from online? Alex and Jimmy?
I think it's for us. It's. I mean, we're a small company, so we have a good relationship amongst everybody. But this is a change in the way we've always practiced. It's always been clean, clean, clean before, but now it's a turning point in healthcare, and every single person is an expert in something in your organization, and you've got to keep your ears open because you never know where the best ideas are going to come from. And, you know, traditionally people with the education were the thought leaders, but it's different now. And, you know, the world's different. And for this particular area that we're talking about today, there's vertical and horizontal integration across the whole thing. So the word meritocracy comes to mind. It's best idea wins.
And yeah, I agree with that, Alex. Meritocracy is a great word to use in this whole piece. Speaking from somebody who works for a large organization, it's often difficult to drive a decision across such a large number of people. And I used to get quite frustrated with the size of the organization and the slowness of it. But over the time working with health, I realized that often it takes a long time to make these decisions because they're important. And often when the decisions are made, they actually stick. And so one of the things I've seen recently is obviously a huge uptick in conversations around sustainability. We're trying to make sure that people understand what it is, how it applies to them. But ultimately, it often just takes a bit of time just to educate all levels of our organization and then to make the appropriate decisions to mitigate risk from a clinical and from an operational perspective.
Thank you. We run out of time. Last question for all the speakers. Today, particularly this afternoon, we talk about sustainable healthcare and circular economy solutions. And many of you guys and people online or people in this room talk about collaboration between your internal stakeholders and external stakeholders. My question to all of you is, give us one tip. What is just one tip in terms of collaboration, bring all those stakeholders community together, transition into a more sustainable healthcare and circular economy innovations?
Keep it simple.
Keep it simple, yes.
Have a yarn, sit down, share food, respect each other.
That's good advice.
Great.
I think it comes down to your probity. Like understand probity, engage with industry and be transparent. You can communicate a lot without breaching probity and procurement. The more industry knows, the more they can assist. We know that we can't address scope 3 without everybody on board.
Yeah, good.
Yeah, I'd agree with that. I think partnership, communication, patience, being willing to really listen carefully to what the concerns are for us. It was understanding what New South Wales HealthShare needed from us and then working in partnership to be able to deliver that.
I would say a very similar message for HealthShare ourselves, because we can't make a difference without a partnership with the districts. So for us, it's about listening really carefully to what's important to you, thinking about the geography of your sites, the strategic priorities, what's affordable, and making sure that we're working in a way that delivers on all of those things.
And I'll say the kitchen manager at Bowral Hospital, which is one of mine, says the floor has never been cleaner. And I will say you have to tick the boxes. I know people say it's a tick box thing. Sometimes you have to tick the boxes and make sure that you've involved people know what's happening. So when that one person comes up and goes, yeah, by the way, you forgot something very important. You're listening. Be open. I've been caught before.
And I would say probably, getting together around a central purpose, having the right people at the table. And sometimes there's also your passionate people as well to help drive the whole thing.
Gaining engagement. But when I say engagement, I mean know your why, and exactly to your point there, your purpose. So not just your why, but your stakeholders' whys. That's internal, external. Understand that, and you'll be able to pitch it and have the right conversations and engagement piece.
Excellent. Alex and Jeremy.
Well, just so I don't say the same thing as everybody else, I would say know your outcomes before you start. You've got to do it. If you're going to be the leader, you're the one that's got to think the most. So try and nail down as much as you can before you engage other people. But then equally, don't assume you've got things right. Keep your ears open. The idea in a medical consultation is that the doctor and the patient, you've got two experts sitting down together. The doctor is the expert in the healthcare and the patient is the expert in the patient. And you've got to agree a plan together.
Excellent. Jeremy.
Gosh, I think my tip is just be bold, be curious, and don't give up when it gets hard.
Wonderful. I think please join me to again, thank you all the speakers. That's the time for this session. Thank you. Thank you for all your time. We will now have an afternoon tea break. Please take a look at the posters and sponsor stand in the foyer and on our virtual hub for online attendees. Our next session will start 3:15. See you soon.